Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and Jorge André.
Hello, everyone. Welcome to episode 9 of the Soft Bites podcast. Hello, André. How are you?
Hello, how are you, Manuela? Nice to see you again. Here we are once again for the episode number 9, right?
Yeah, episode number 9. And today we're going to talk about how we can still have a life and at the same time being a dedicated dentist.
Seems impossible, right?
I don't know. I think it's if you ask all the dentists, I think that they will tell you that it's possible. But then, in a very practical way, if they think about it, then it's hard. It's hard.
Yes. I agree with that. I agree with dentists. We have an underdeveloped capacity of setting boundaries and saying no. I don't know why. I think I know why, because it happens the same with me. I'm not very good at this, managing this balance. But I think it's we do have this underdeveloped capacity of setting boundaries and saying no to staff and to patients. There are several reasons for that, and I'm sure we'll discuss a few of those during the podcast.
Yeah. One of the reasons for that, and you just said it. So boundaries is the secret. But one of the reasons for that is the fact that dentists identify themselves with the profession. So if something fails, or it doesn't even need to fail, it just needs to go less well. So if 90% of your day goes well, but 10% or a small percentage of your day goes less well, it doesn't even need to be a failure, but goes less well, then that's what you're going to remember in the end of the day. And that's what and you take that less well or that failure in a very personal level, because that's you that's at stake. So I think that this is one of the reasons why it's hard for dentists to disconnect and to have this life from outside the dentistry, because it's of course it's always hard to deal with failure, but in dentistry it's not only failure, it's a patient that's it's in pain, it's an assistant that it's not so happy. So it's so many things happening. And if you identify with all of that in a very personal level, then you're going to not in the end of the day, you're not going to be well.
Mm-hmm. Yeah, I think I suffer from that. I feel myself a lot in the words that you were saying, and 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 I teach some of those advice to dentists. So yes, I do feel that sometimes I feel that I have gained the day if the work goes well. But I
That you are
think
on top
that's
of the world.
yes, which is a big trap, isn't it? Because life's much more than dentistry, and the problem is that it works both ways. Yeah, you are on top of the world when things go right, but when things go wrong, which inevitably they will sooner
They
or
will.
later. Yeah, it's not a question of mitigating risk or this. I mean, we know that things will sooner or later will have um, a treatment that goes wrong. Sometimes a very expensive treatment in a very sensitive patient, or sometimes you delegate the patient to someone else. You refer it and it doesn't go right. Uh, yes, but it happens to me a lot, and I do feel in the beginning of the podcast I was talking to you that I have a lot to learn from this, which is how do I stop making this confusion between who I am and the dentist that I am, because it's very easy when you are a dedicated dentist that you are completely overwhelmed and absorbed by the profession. So it's something that I struggle a lot, and I know the answers. I know how to do it, but I have to say that in my personal opinion, the big mistake that I did was that I opened a practice, um, and I did all the work, all the general dentistry. So this means that you got your patients used to you, and this is the mistake that I did, and I've I've reduced that. I've corrected it, but still, like we were saying the last episode, I do see some patients, and I still feel sometimes obliged to answer some personal message to some patients, and sometimes I do have to stay longer hours because of some specific patients that you got them used to you. And it's funny because actually yesterday, two people came to me. One of them was saying that, oh, my boyfriend wants to open a practice for me, and he wants to do some management, and he wants to open a practice for me. That was one. The other one was a girl that she was asking, is it the right time to open a practice? And I was asking her, so what's your goal? I says, and I told her, look, by what I know you, I think that your goal is to work well. I mean, you gain energy by um, knowing that you are doing a good technical work. And she says, yes. And but is it also, do you also have financial goals? And she said, no, I want to have more free time. I'm well into my 30s, and I understand by what I read and by what I see that I cannot work with this rhythm for the rest of my life. So I need to have some sort of business that can run for itself, which is the big goal, right? And that's the big goal. And to both of them, what I told was this: I would make yourself from the start um, someone that does a specific part of work within the practice, not to be the center of the practice. So I would advise them, look, if you are going to open a practice, just hire a general dentist as soon as possible. Yes, growth will be slower, right? Because if you do everything by yourself, you will earn more money, right? But will also have two things. You will get yourself tired quicker, and you'll also make your patients too much used to you, too much used to you, which is something that I can never overemphasize because this is really a big trap. So for people, and if I look back at myself, what I would have done today was I would have not relied the practice from day one so much on me. I would not have relied the practice so much on me from day one. and this is easier said than done, uh, because it's difficult also to hire someone to open a practice, right? Because who is available to be there when you don't have patients, isn't it? So you have to do it for yourself. And if that is not possible, if you cannot hire someone, I think that you have to also to change the mindset. Because if on the back of your mind you are always thinking that as soon as possible someone else will do the control appointment, someone else will do the endo, someone else will do the emergencies, the way that you talk to the patient will be immediately different, because you will know in the back of your mind that you cannot spoil the patient. This is a strong word, but I think that's exactly the mistake that we do. We spoil the patients too much in the beginning of our career when we are opening a practice, because we want to please them. Again, that thing from empathy and compassion, right? And yes, that will be my biggest advice, is just to start to think about these things from day one that you open a practice. And if you already have a practice, just try to undo what you have done. Even in case of, let's say, I won't say an emergency, but in case you really have if you are in a situation that you really have to reduce your work, you can always tell the patients, look, it's just not possible for me. It's humanly impossible for me to keep doing everything. So yes, I'm sorry, but I will not be able to do the control appointments with you anymore. And people react in very different ways. Some patients, they get mad. Some patients, they test you. Oh, really? Why not? And you just have to be strong with them. And by being strong, I mean being willing to let them go.
So
I know it's
again,
difficult.
again to the boundaries. You have to know what you want, and you have to to set that boundaries. But let's go a little deeper. And I know that you can go a little deeper on this. Let's go on the mindset. Let's go on how can you still have a life and at the same time being a dedicated dentist. So let's go on the part that how we don't identify ourselves with the profession. How can we do that?
I think I'm not a very good person to answer that, because a big part of my profession, actually almost all of my professional career is dedicated to dentistry. Well, within several, not clinical dentistry, I mainly do three things. I do clinical dentistry, I do a lot of teaching, and I also do a part of, I also develop an app for dentists. So it's all within dentistry, right? But in order to accommodate time for the courses and for the other activities, I really had to say no to patients and let go some patients. But yes, it's all within dentistry. Now, if you ask me, which is specifically what you were asking, how can we have a life? I think you have to be practical. I think managing your agenda is very important. Booking vacations as soon as possible. For example, I have booked my vacations for 2022. I have booked some courses that I have for 2023. And I will also book my vacations for 2023, always with the mindset that I want to make them longer and longer. That's one thing. Another thing regarding the mindset is, I think we are all very different in what terms, how do we see ourselves. Some people are very family oriented. Some people are very intimate relationship oriented. Some people are very socially with friends oriented. Some people are sport oriented. Some people are traveling oriented. And I do know the dentists that the biggest part of their life is their family. And I also know some dentists that a huge part of their life is their surfing. And So it's very different from 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 dentist to dentist. For example, for myself, I have to admit that I had, especially during my 30s and even 20s, but 20s it's normal, right? I think you are testing stuff, you are testing everything. But during the 30s, I think I was quite taken by the profession in several ways. During the 30s, I did my transition. I reduced my clinical time to do more courses, which is something that I wanted to do, that I really wanted to do. But at the same time, it was always profession, profession, profession. And one of the things that I see for myself is that, and now I'm getting back to it, is that I think the most important thing in your life, especially as you get into the 40s, sometimes 50s, maybe, is that the people around you are the most important thing of your life.
Mm-hmm.
And that is something that this is something that sticks into your mind in very different stages. And some people, due to the dynamics of the family, they have this presence since day one, since ever, right? So they understand there's a profession, but there's something more important, which is to get home earlier. Some people understand this in their 20s, some people understand this in their 30s, some people understand this in their 40s. But for what I see today, even families, I see a lot of, I see many dentists, especially practice owners, that don't have very decent times to reach home. But that's not only in dentistry, but in dentistry especially. And as for example, I do find sometimes a lot of friction between, for example, a husband that has a job from 9 to 6, does not work on weekends, and that is married to a dentist that is a owner of a practice, for example. Basically, she has no time to get home.
Mm-hmm. Mm-hmm.
And I see a lot of those cases. I see a lot of friction, and these are really people with that really work a lot, and that they place themselves in positions to please patients and to pay the bills. These are really like heroic positions, right? Even though there's nothing heroic about them, because the real hero is at home. But the real hero found a way. This is a quote from the book that I've mentioned before. Is, I think, Getting Things Done or something like that.
Mm-hmm.
We will link that. And there's this very interesting quote, which is the real hero found a better way. The real hero is not the one that works hard from 9 until 9 and reaches home really late hours. The real hero thought about it and really found a way to make it better and get home earlier.
Mm-hmm.
And I think this is the real art, right?
Yeah.
Finding a way to set boundaries and to get and to get home earlier. I think I lost a little bit in the answer, but regarding the mindset, and I speak for myself. I think that as you get older, I think you realize that the most important thing around you, the most important is the things, that people that are around you, your family, your friends, your relationships, and that's the most important thing. And
Yeah.
it's very easy to neglect them.
Yeah,
Especially
yeah,
if you
it's
own a
very
practice.
easy. You said very interesting things, and things that I really relate, and that I hear them every day from colleagues. And I think that sometimes what it needs, and what dentists need, is to be able to listen to themselves. And sometimes that's very difficult, because you are in this life. You need to keep on going, and the life pace is very fast, and you have already your days scheduled, and it's not only work, it's your family, and you get into this automatic pilot mode, and to get out of that, it's very hard. And what I observe is that sometimes you don't even need to get out of that. You just need some time to with yourself, to listen to yourself. You just need a pause. You need and even this time that I'm talking about, it doesn't have to be a long time. You don't have to go to a retreat, 5 or 7 days. Sometimes it's just 5 or 7 minutes during your day with yourself, to listen to yourself. Because if you only listen to the noise outside, then you will keep on going with the automatic pilot, with what we called in the mindfulness world the doing mode.
Yes.
Right? You keep on doing, and nothing wrong with that. Nothing wrong with that. It's life happening, right? And the doing mode is not only at work, is at home also, but in order to mainly to realize what those boundaries are, what you need to also fulfill yourself, not only work but yourself. You really need to listen to yourself. And if you listen, if you create that connection with yourself, then you start acting based on your ideas, right? And what you feel it's right, not only through the noise of the world, but you start listening to what makes sense to you. And also it's very important, because if you don't have time to listen to yourself, if you don't have time to listen to your own thoughts, then and I see this all the time, and this is very natural. We take our own thoughts as truth, right? It's our most intimate thing, right? It's our thoughts. So but sometimes they are just movies inside our heads.
Yeah.
And the conversation that we started with, the fact that we take things so personally, and this is one of the things where mindfulness can help you. If you start to pay attention to your own thoughts, you will realize that you will start to create this distance, and you start to distinguish what is truth from what is not, and you will start to have this relationship with yourself that will make your life easier. The same. Speaking in a practical example from dentistry, let's say if a treatment doesn't go according to plan, or if a treatment fails, you will have, instead of identifying yourself with the failure, you will have the ability to understand that you are not that treatment, and you will have the ability to accept failure and to learn from failure, so that it doesn't happen again in the future. But you will also have to deal with all the emotions that come with that failure. But so I think that's one very important thing, and how we can have a life, and not just a life, but a good life, and being a dedicated dentist, and a good dentist, a great dentist. So having a great life and being a great dentist is to be able to have this time with yourself, to listen to yourself. And you can do this by having a meditation practice, and you can do this by having a sports activity, And you can do this by being in nature, and you can do this by surfing, just like you said. And that's why so many dentists have sports activity, surfing, with windsurfing, running, whatever. But sports is a kind of meditation,
Of course.
right? It is. You are with yourself. You are in this with your senses. You are experiencing yourself. But I think this is a big part of it, is being able to be with yourself, being able to listen to yourself. Because how can you set boundaries if you don't know what really serves you?
Mm-hmm.
And for me, it's the only way, because even if you say, okay, I want more time to my family, and I have to be home at 6 every day.
Mm-hmm.
But then all your actions don't match that will that you have.
Yeah.
Then all you get is frustration. Frustration. So if you really listen to yourself and you connect with yourself and you understand why you need that time, and you can make a plan, even doesn't have to be a big thing, but just a mental plan of small actions to take to achieve that goal, then it's, and I see it every day. I guarantee that you will get home at 6 o'clock every day, and you will be easier because you will not focus on the negativity. So on the things that you have to say no to, because you will have, like we said on the other episode, it's not easy. Change is never easy. You're going to have to say no to a lot of things. Emotionally, you will feel that, but you will know why you are doing it for, and you will focus on the other part, on the
goal,
things that you are saying yes to.
Yes, that's very interesting. I was taking here some notes. I have the habit of writing down goals like every year and reviewing them, like sometimes every month or every week. And what do you think about that? What do you think about writing goals and being specific about it? Like, for example, well, I want my typical day, I want it to be like this. I want to have this amount of vacation per year. I want to have this amount of free weekends. I want to have this. I want to arrive home at a specific time. What do you think about that? You think that's?
I think that's good. I do it for myself because I usually say this all the time. If you don't know where you're getting to, if you don't know where you want to be, you never get there. You get lost in the way because you don't have a destination.
Yeah.
So I think that's very important. I think
I don't know, but it's also something that we will practice on the leadership course, right?
Yeah. It's very important that you have a clear vision of what you want. It's very important. We already said it. We even have an exercise in another episode of the podcast. You have to have a clear vision of how you want your days to be like as a dentist. Yeah, you have to. Of course, first you have to bring this awareness to how your days are at the present moment, and you have to understand what makes you, what brings you joy, what makes you happy. In a very practical way, if you are thrilled about seeing children, and if you have when you have like an adult endodontics, you are in a state of anxiety, then stop doing endodontics, send it to a colleague, and start only seeing children and become the best odontopediatrics that you can. Right? So that will be our goal. That will be our vision. You will be the best odontopediatrics that you can.
Yeah.
And in 1 year, I guarantee that you will be that pediatric. But you have to have that vision. You have to bring awareness on how you are spending your days. You have to bring awareness on what makes your body vibrate with joy. And then you make these small changes through your days, and you will get there. It's not going to be on the next week, of course, but you will get there. So not to answer your question, yes, I think that to have goals and to have a clear vision on how you want your days to be and how you want your life to be, and that's very important.
Yeah. I think that for the dentists that are listening to us, some of them may be thinking, yes, but it's so difficult today to say no to patients for a variety of reasons. One of the reasons that I was taking some notes here is that the fear of financially we place ourselves in vulnerable position, right? So, like your example, okay, so I'm not only going to see children, okay? We have to think about the change that you are about to do. So, if you own a practice, okay, you have more control. Let's make a smooth transition. Let's have a positive communication with patients. These are my goals. I have it written down, so I have to follow this path, and I'm going to develop a strategy together with the team and the dental nurses on how we should talk to the patients and tell them, look, Dr. André is not going to do any more endo, he's just going to do this. He's specializing in that. What is the strategy? That's number one. But that may be financially scary, right? And especially in a country like, for example, Portugal, where really things, where the price of dentistry is just completely undervalued, and which is like it is what it is, but it's really something completely impossible, also almost to work with. And if you face yourself, this is a question: if you face yourself in a situation there, you know that to reach your goals, to do what you want financially, it will be very difficult, if not impossible, within dentistry or within the country that you are working with or within the practice that you are working with. And here we are talking about radical changes. How does one approach that when he really feels, look, this is not possible in this practice, this is not possible in this country? How do one approaches that, and how do one finds tool to remain conscious throughout the process and to realize that it needs to make some big changes, because that's also a big part of sometimes to be a dedicated dentist and to also have a life. You have to make some radical changes from the situation that you have. In Portugal, this is very typical, because, and for me, this is a question that is particularly close to me, because I spend a lot of time with dentists in their 20s. And it's very frustrating for me sometimes to realize the financial situation that some of them are. This is really a shameful situation for our country. It's just completely, really, really almost unthinkable what some dentists, and not only dentists, but even doctors live here in Portugal. But in some other countries, we have similar situations. I mean, what would be the tools? What would be the emotional tools? What would be the strategy that you would advise to someone that realizes that, well, I need to make some radical changes, which may mean moving out to another town, may mean moving to another country, may mean moving from this practice. What would be the advice that you would give?
I think that first of all, radical changes have to start with small changes. So step by step. Having a clear vision is very, very important. And then to really be self-aware of your situation, and also to be very self-aware until to understand your limits. Until where do you want to go? Do you want to change countries or not? For example, I came to Belgium when I was already in my 35s, but attention, I had no children, no kids, for example. So
makes a big difference, of course.
Yeah, of course. So you have to really be self-aware of your situation.
And this is why. Sorry to interrupt you. Just this, which is. So it's important to think about these things early in your 20s.
Yeah, it's very, very, very important to be aware of what you want yourself, and to be aware. And I mean, because there's nothing wrong, even if you have even if you say, okay, but I don't want kids, but I want to stay in Portugal. I want to stay in my country. It's totally fine. There's nothing wrong with that, because that's your choice. And you are going to make choices based on what you want, what serves you better. So if you know that, then it's going to be easier for you to make choice, and the hard choices that you are talking about. Because even I was talking to a colleague this week, and she works in Belgium, and she's almost she's 30 something, and she's trying already for at least for 2 years to only do orthodontics a year here in Belgium. And she's working now. She managed to work now only 4 days a week. So she's working 5 days, because the fifth day, the Friday, she's doing the planning of the cases and everything. So 4 days clinical in-chair work, and the other days for the other part. So she's working 5 days a week. But the orthodontics, and she was telling me, because we were discussing about COVID and the aerosols and everything, and she said, because I'm doing 3 days only orthodontics, so only 1 day I'm doing the other part. So she still was not able to do that. But she started planning it already 2 years ago. So step by step, you have to be able to accept that even.
And did she find, and financially, was it a smooth path? Was it how was that in her case?
Well, it came in a very I think it came in a very natural way, because she didn't said from one moment to the other on her practices, look, now I'm just going to do orthodontics.
Yes. Yeah.
Right? She said it. Look, I'm taking the course. She already had done one. She was taking a second one. She said, okay, from now on, she started by opening 1 day. It was Wednesdays, because that's when the kids have the day free in the afternoon here. So she started by opening just 1 day for orthodontics. And she said, okay, let's just fill this day with orthodontics, and I'm continuing to do everything else on the other days. And when she had that day full, she opened another day.
Yes.
And now she has 3 days. Clever. She has 3 days only on orthodontics, another one with the rest, and the other day just for the planning and the treatment plans and all the bureaucratic work.
Mm-hmm.
And this, she started this 2 years ago, and that's her situation. So going back to your question, step by step, you have to have this, of course, you have to be self-aware of the situation that you are in. You have to be very self-aware of your financial situation. That's very important also.
Yes, that's
and you have to have a clear vision of what you want, of how you want your days to be like, of what you really enjoy doing, because also you have to be willing to learn about that. Because when we talk about becoming only an orthodontist or a pediatrician or an endodontist, you have to be willing to invest also in your education for that.
Yeah.
So that's a very important thing also in the beginning. And then slowly you make your decisions. And I totally understand what you say regarding the situation of Portugal. And in the new generations, I know it's very difficult for you to have and to perform the dentistry that you want to perform. And it's a possibility for you to have to even to go to another country to be able to do it, because there are still countries where you can practice the dentistry that you want
with not an excessive amount of hours and with a fair financial return.
Yeah. Yes.
Yeah. And that's why I was at, because this is a reality that I'm very close to. And you said something interesting, which is you have to be financially aware of your situation. And this means that also in these transitions, I think it's very important that you realize that you have to, okay, so I may be financially less stable during a period, but I know this has some specific goal. This has there is a purpose on this. And this is also where saving comes into, you have to think about it, right? Because if you, for example, you have to, okay, I'm going to invest in a postgrad course in orthodontics. Okay, I have to save for that.
Mm-hmm. Mm-hmm.
Yes, I may need to reduce my drinks at night. I may need to reduce my dinners. I may need to reduce the money that I spent on clothes. All these little things are very important, because I think that you have to be willing to sacrifice a little bit if you want to get something else. And I think it's important that people realize that sometimes they need to make an extra effort. Sometimes it is, okay, I'm going to study after work for a few years or for 1 year to do this course. I'm going to not spend as much money. I'm going to reduce my loans. I'm going to reduce the expenses that I have, because I want to get out of my because I don't like the situation. The situation is not meeting the goals that I want to. I don't feel that I am getting the life that I want and the quality of dentistry that I want, which is, I don't feel that I am being a dedicated dentistry here. I don't feel happy here. So in order to achieve that, I have to bear the situation for 1 year, 2 years, or whatever, because then I know that something better will come. So you have to be active during that transition, active and not passive. Yeah. But I will also add to that. Yes, you have to be active, but like I was telling you in the beginning, you have to be preventive. And this is something that I cannot overemphasize. People have to know the rules of, in case you have a practice, people have to know the rules of the practice as soon as they get in contact into you. I think that in the first visit, if you want to have a life if you have a practice, they must understand that this is not a one-man show practice. There are several people, there's a system, there's a philosophy, and they go there because of the philosophy and not because of one specific person. I really think this is one of the biggest traps that we dentists get into. And when we realize, when people come to the dentist in the practice for you as a person and not for the practice as a system, and I know it's almost seems like impossible. There's always this mix. I mean, they like the doctors and they like the system, they like the way that things work, but I think it's extremely dangerous. And again, I'm talking when you own a practice, because this is a trap that most people fall into. When you have a practice, you have to realize, you have to make them aware as soon as possible and as early as possible in the development of the practice, that the practice is not you. The practice is an entity that is combined of several people. I wouldn't even say several caretakers, care providers that can sometimes change. Right? My endodontist may go somewhere else.
Yeah.
Right. So if you have this mindset, I really think that even the communication with the patient changes, because we have this tendency of, like I was saying, we overspoil the patient, especially the Latin style that we have. We want to make them warm, make them feel warm, make them feel welcome, that we care about them. And this is very important in dentistry, because it's a stressful environment. But the other side of that is a complete addiction of the patient to you. And this has the potential to completely jeopardize your work-life balance.
Yeah, but also because dentistry is so special, because if a part of the work as a dentist is that the patient feels comfortable with you, that the patient trusts you. So that's part of your work during the appointment. If you have that trust, if you have a person that is comfortable with you, then your work is going to be much easier. It's going to feel relaxed. It's going to be not tense, even in his muscles, right? So you're going to have a much easier appointment, and
But
then
setting boundaries to patients, it's so important and so difficult.
Yeah, it's very difficult, and you are absolutely right. In the northern countries, we have much more. They have much more. It's much more easier. It's much more easier. No one. I don't. I mean, in Belgium and even in the north countries, it's the same. I do not see, I don't have the experience of patients calling and asking for appointments at 6 o'clock or after work.
Yeah.
The last appointment it's at 4:30 or 5 o'clock. That's it.
It's a more between commas developed society, let's say.
It's normal. It's normal. We don't. Also, the clinics don't work on weekends, so it's like people know that, so they don't ask for that.
Yeah,
they know that it.
But that's that's a big difference between Southern European countries, Portugal, Spain. It's a big, maybe Italy as well, but it's a big difference. And it does not only has to do with countries, but it also has to do with the personality of the dentist. It's very tempting in the early years that we want our dentists to fall in love with us, our patients to fall in love with us. right?
Mm-hmm.
And that's that's just a big
But
trap.
that goes with what you say, right? They don't have to like you.
Yes, you have to care about other people, but don't care about what they think of you.
Yeah.
And this is the biggest balance, and this applies to every single layer of what we discuss in this podcast, every single subject. You have to care about other people, about the staff, about the patient, but you cannot care about what they think of you. I really wish that I was aware of this earlier in my career. Really wish
Mm-hmm.
that
Mm-hmm.
about this, and,
Mm-hmm.
and I do, and I place a lot of effort whenever I talk about this. Please, if you are about to open a practice, if you are on the early stage of your career, always remember that yes, you want them to like you. Of course, you want to take care of them, and yes, you have to respect them, um, but you don't. But your success cannot depend on the on whether they like you or not. Because one thing is respecting you, the other thing is like you. No one likes
Mm-hmm.
to be used to a dentist that does that general dentist, and all of a sudden, very typical situation. So, yes, oh doctor, I finally conquered my fear of dentists with you. I feel so good when I come here. I never thought I would achieve this. You work with the patient for 1 year, 2 years, and the second year, look, I'm not going to see you. Uh, it's difficult, and this does not depend only on the country. It depends on the personalities,
Yeah.
and it depends
Mm-hmm.
on many things. But eventually you have to do that. You have to tell them, look, yes, but it's not possible for me at this point. I will be available if you want, but I'm moving into that direction, and I want to make sure that I will find someone else that will take good care of you. But if you are the owner of the practice, that assumes an even more overwhelming situation, because you are dealing not only with the emotional part of this patient, but also with how am I going to find someone? Will I need to? So basically, if you are the owner of the practice, the story does not end in that conversation. The story then goes on to I will have to uh, talk to someone else in my practice to tell them, look, you have to take care of this guy, of this or this patient with some special attention because of this and that. So, but if you do that, look, you have solved one issue, but you have created another one in your head. You understand? So this is why prevention is so important. This is why making sure that everybody is on the same track. So there's this philosophy in the practice, which I see, there's this system in the practice. And yes, the goal is to be to have 80 to 90% satisfaction,
Mm-hmm.
knowing that you will not never be perfect, knowing that. And there are so many examples of this where you have to place boundaries in patients, and you know that in my 30s and in my 20s, I never understood that when someone said, "Look, I just want the 80%. I don't want the 95%," because the leap from the 80% to the 95% is an emotional price that you have to pay
Yeah.
as a leader.
It's very
That
demanding.
you start to get into micromanagement, you start to get into confrontation because people are not perfect, they will never be perfect. And yes, some patients, they need to be set very clear boundaries, very, very clear boundaries. Let me tell you a story that happened on last Saturday, yesterday.
Mm-hmm.
Um, and this is, of course, that relates more to practice owners, but not only. I had this patient that was referred to the practice for me. Someone was doing 4 anterior crowns. The provisionals, they were not bad at all. They were good provisionals. But she came and said, look, I was treating someone else, and I wanted to have more triangular shaped teeth. Basically, I want my papilla to grow down. I
Mm-hmm.
want my papilla to grow down. And this is why I came to you, because the guy told me, look, if you want to really have this degree of perfection, you have to see this guy. So, but then I realized that she was extremely demanding. But you know those patients that are not in a disrespectful way, but always setting the standards higher and higher and higher to see if you can achieve them. And I'm going to tell you how I deal with that. And it maybe sound a little bit harsh, but this is the way I do it. And I always told her, look, we will do this. We can get those papilla down. We can get that papilla down. We are going to do a treatment plan that is going to be staged, and you will go through periodontal surgery and opening spaces on the provisionals, wait a couple of months to see how much they can go down and for you to realize. And then you move forward on the treatment plan. And if you are not happy, then it's fine. We'll not go for the finals. That was all written down. And it was me and it was another associate working on that. But every time that she came, she was always asking, well, but can you guarantee to me that this papilla will go down? Can you guarantee this to me? And in the beginning, I was, okay, yes, she's demanding. But the first thing that I told her, look, first of all, your case is not only a foreign to your teeth. Your case is a case where you have to place your chin forward because you are asking me a situation about your teeth, but actually the problem is with your face. And I'm very, very, very direct about this with patients. Also because I'm in a position where I know it is the case. And because I sometimes I prefer not to treat these patients. And people sometimes they look for cosmetic treatments to fill other gaps emotionally.
Mm-hmm. Mm-hmm.
And one of those, which is not an emotional, which is your teeth will never look, if your face does not look good, and this is a very technical part, of course, but your teeth will never look good. For example, class 2 patients, which is the case of this patient. Class 2 patients, anything that you would do on the front teeth will always be excessive because the problem is that the chin is very backward or the maxilla is too much to the front. Mm-hmm. And you have to always keep reminding them, and that comes with experience. Look, initially I told you, your case is a case of orthodontic surgery. Oh, I don't want to do that. Okay, so you don't want to, let's see. But because we want to please them and we want to do a good job, sometimes we forget because they abuse you in the communication, and sometimes you don't have energy to keep always fighting them back. Because some people are like that, they abuse, not in a disrespectful, but technically they. And we did the perio surgery, did the provisionals, the papillas came down, not as much as probably should expect, because a papilla at the age of 20s occupies about 40% of the tooth length. But in this case, we could manage to get the papilla down for about maybe 2 millimeters, which is already very good. The result was very technically. I know it's not possible to get better than that. Mm-hmm. And I thought, look, yes, this is what we could get with the ceramics. We may have an additional millimeter. And before prepping for the finals, Katia was seeing her, and I went there. And again, can you guarantee me that the papilla will go down? And I sit down with her. Look, I can guarantee you one thing, that we are all going to die in a few decades. That's the only thing that I can guarantee you. And it's starting to be a little uncomfortable for me because you keep pressuring me. And you know one thing, I don't react very well to this sort of behavior from patients. You know that. So I really want to make sure that you want to go forward with this, because I'm not going to treat you if you keep with this behavior. And I shut up myself and I let her talk, because it's very important that you make these messages really sticking to their heads. Mm-hmm. And when I say that, I am completely willing to do the calculations of what we have done so far. She pays what she has to pay, and she moves forward to another dentist. I said, oh, yes, okay, I understand. So let's move forward. And I said, you are always forgetting where we have started. And you have to look at where we have started. So then this Saturday came the finals. And I had a full morning to bond them. And I placed them, and I said, I just wanted to know one thing. Are they good for me? Is this the result that I know that it will not be possible to be better? Or is this within the 80 to 90% range? Mm-hmm. And it was. Mm-hmm. And she says the same thing. There were the two new dental nurses there. Says, "Oh, I don't like these spaces. I thought they were going to close." And I raised her up and I said, "Look, you are pushing me, and you are not being unreasonable, and I don't react well to these things. And for me, this is the best situation that we could get. I don't like your behavior with me. I think you are being abusive with us." And the other two nurses never heard me talk like that. And what I propose to you is I'm going to place you the provisionals. I'm not going to charge you the ceramics. You are going to pay only going to pay the lab work, and you're going to go elsewhere, because I don't think you have. You're not a reasonable patient, and I don't treat reasonable patients. And she almost started crying. "Oh no, yes, let's do it." But some patients, they will push you to your limits, and for someone seeing this from the outside, it may seem like I'm extremely cold and extremely rational. But when you work in aesthetics and when you work with these sorts of patients, but it's not only aesthetics, it's, I mean, in dentistry in general, for ortho, it's the same. You really have to keep pushing. The boundaries need to be there. For some patients, you tell the boundaries once. But some patients, they don't know what is boundaries, and they will always try to push it to see how much they can get from you.
Mm-hmm.
And fortunately, these are not many patients, but they can completely ruin you a month in your head. They can completely unstabilize you if you are not convicted enough on what you are doing and what you are saying. This is why written treatment plans, and make sure that you are, because if you avoid a confrontation with a patient, you are just avoiding a problem. Mm-hmm. And it's not about being disrespectful. It's about telling them, "Look, I have not done anything wrong with your teeth so far. So please make sure you go elsewhere. You pay what you have to pay, but I don't want you. I don't think that you belong here to this practice." And something that I always tell them, "Look, you are looking at me like I was an hairdresser. I'm not an hairdresser. You cannot arrive here and ask me," because an hairdresser, you say, "Okay, I'm going to paint my hair in blue or pink, and it's fine. I will do that." Mm-hmm. But if something goes wrong and it grows back again, if I do a mistake in your mouth, this is a healthcare place. This is not a cosmetic place. Even though I work with aesthetics, you cannot do whatever you want. There are limitations. This is what I am willing to do for you. And setting these boundaries, it's really important, because the more successful you are, the higher the chances of you getting these patients. And these are extremely, extremely energy-sucking patients.
Yeah.
Because the issue is that it's not about you. It's about them. Mm-hmm. And you have to have compassion, of course, and you have to have sometimes empathy, but you really have to be very clear on the boundaries that you set, and make sure that your speech with them is strong but respectful and fair. This is very difficult. And again, this comes from prevention. This comes from having everything written down, but even still, some patients will push you to your limits, as well as staff, for example. Another story. One of the new nurses, I told, "Look, I don't want," how do you call gel nails, right?
Yeah.
Those.
Mm-hmm. Mm-hmm.
And so I told them, it's in the manual, you cannot use that. But then the nails were not gel, but were slightly too big. It's like, okay, let's see if this passes. Let's push him to see if this passes. And I don't give any. This is something, this sort of attitude, and sometimes it's just because sometimes they are just immature, or whatever. But these sort of attitudes can really push your buttons, and you can really get emotional. It's very important that you not get emotional, but still say, "Look, I've said what you are. It seems like you are testing us. Do you think it makes?" And sometimes you have to bring some humor to the table. Do you think this makes any sense? Mm-hmm. Because it seems like you are not playing around with me, right? "Oh no, of course you're not playing around, but it seems like you are joking around with me." So it's fine. I mean, if you understand what I say, it's fine. If you don't understand, you can stop working with us and go elsewhere. We'll still be friends. But this is a sort of behavior that seems like you are just pushing the limits. And I think it's funny, but it's not funny for me, for example, because you have to be willing to address the situation and leave it there. For example, this lady that I talked to you about the papillas, it stayed there on that Saturday morning.
Mm-hmm.
It stayed there. But
That's it.
for that to stay there, I need to really look, hey, your behavior is completely unacceptable in this place. And this is why prevention and systems and writing down your values, know exactly what
Mm-hmm.
kind of institution you are developing. This is very important.
Mm-hmm.
Because I want even though I work in aesthetics, I want my practice to be health-based, because I don't think you can have peace of mind any other way. If you have your practice based on cosmetic or based on or saying to the patient that everything is easy and everything can be fixed and they can have the smile that they want, which is a very common marketing strategy from dentists today. And I think that's very dangerous when you say to a patient that they can have the smile that they want, because it's not true. It is not true. Health is not cosmetics. Health is not manicure. Health is not hairdressing.
Mm-hmm.
People, patients, they have this confusion in their heads, not only because they look at the dentist something between the barber and the doctor, but also because dentists themselves, they dig traps for themselves. I mean, if you market yourself as that you can do everyone can be perfect with veneers, and then that style also gets inside the practice, and then you start to work. Well, we're going to think. Don't worry, we will fix it. You will like it. And at the end, they don't like it because we haven't warned them about. Then you are. And for me, that's also because sometimes it's not only about the time that you are in the practice; it's about the problems that you bring home. So you can leave the practice at 5, but what does it matter if it is a complete mess there? You are going to bring the problems at home.
Mm-hmm.
And you're going to think about that with unsatisfied patients and so on. So yes, it's also about it's about time, but it's also about mental stability and yes, you can get home earlier, but you want to get home in a healthy way, mentally healthy.
That's it.
Right?
Yeah, that's it. That's exactly it. And you said some very important things. First, and just to make a summary of what you said, I think it's very important. But this comes with the experience, of course. If you just finish, if you are just out of dentistry school, you have to have some practice to be able to gain this experiencing on feeling, because there are some patients that you have to say no to, because just like you said, and this is another thing that I wrote, make a note here of what you said. There are some patients that they look for an aesthetic solution to fill in an emotional gap. And you have to also be very careful with that. But again, this comes with experience. You will learn to distinguish this with experience.
I think that could be a good theme for another episode. I mean, how to deal with difficult patients emotionally in terms of communication. I think that's
even how the patients that you have to say no to, how to identify a patient that you have to say no to, and that comes for me, it comes with experience, and again, to be able to listen to your intuition, to build that connection with yourself, to really don't ignore the red flags, because we all feel them. I mean, you were describing that situation, and you said it several times. In the beginning, she already did this. In the beginning, she already did that. So the red flags are there. You feel it in your body. So, and intuition for me, and I talk about this a lot in my course, intuition, it's a big thing in dentists. You really should know how to use it, how to be aware of it, how to not ignore the red flags. And another very interesting thing that you said is that you said we have to keep on remembering them, right? And this is I listen to this every day from dentists. We as dentists, we think about as remembering the patients, but they don't see it that way, because for us, it's so obvious, right? But for them, they don't understand the technical part. It's just the emotional part.
Needs to be written.
That's it. Because all they have is the emotional part. Yeah. All they have is this image that they want, they think that if they have that image, they will feel better.
Yeah, but let me ask you something. Do the patients have the same attitude when they are going to see a doctor, like an ophthalmologist, orthopedic surgeon, a psychiatrist, whatever? It's completely different, isn't it?
Yeah, of course, it's completely different, but it's not all the patients also in dentists.
Of course, yes, right? Of course, but there's this tendency towards, and why is that? Because what happens is that sometimes dentists get into the profession because they think they will have the same level of, I would say, seriousness and that health environments have. I mean, doctors sometimes, for example, medicine works with limitations, with age limitations, with body limitation, with disease limitation, with genetic limitations. But we as dentists, we tend to forget this, especially when we work in oral rehabilitation and aesthetics. We have this tendency, patients look at us like we are sometimes some sort of magicians because they see someone else on the TV with a big transformation, and they look at us like this is possible, and if it's not possible, it's because he's not good enough, right? Mm-hmm. And this is a big source of frustration in dentists. And for me, I also, because of the experience that I have, I am completely more. I really want to set a patient for the reality. So this is the reality. This is what I'm dealing with. This is what we are dealing with. This is the price. This is the limitation. This is the time it will take. And it's almost like I am always looking for the red flag. Because if they raise a red flag, I'm completely, we tell them immediately, look, no, you will not be able, we cannot guarantee you that. And for us, yes, it may seem a little bit, the first impact may be a little bit not very pleasant for the patient. I mean, it's not unrespectful, but it's very direct with them, because this is the way that, for complex cases, the way that we establish boundaries. But like you were saying, when you are not experienced enough, you don't see those red flags. You don't prevent those red flags.
You need experience for that. You need experience not only to identify those red flags, but mainly to acting accordingly. Because I think that in the beginning, you don't even identify it because you don't have the experience. But then you start identifying it, because you want
to please.
We already talked about, because you want to work and you want to please and you want to be liked. Then you identify, but you still say yes, but you keep on remembering them. Yes. And you always have but I told her, I told him. But experience brings you what you just said, to act in an assertive way and to say, look, I'm sorry, I cannot help you. What you are asking, it's out of reach for me. So please
go
elsewhere and find help elsewhere. And then you can go home and you can disconnect and you can, because just like you said, I mean, how can you still have a life? And again, I say this is very important, a great life, not just a life, a great life. And at the same time, being a dedicated dentist is by when you close the door at the clinic that you feel at peace.
Yes.
Because if you close the door at the clinic, even if it's at 5 o'clock in the evening,
Yes.
even if you just work 4 days a week,
Yes.
you work 4 days a week in the chair, and you go you have a last appointment at 4:30 in the afternoon, and you are home at 5 o'clock every day, and you pick up your kids at school, etc. If you close the door at the practice, at the clinic, and you left behind a mess, right? If you are thinking of the things that you did that you should not have done, or if you are thinking of the times that you should have said, no, sorry, I cannot deliver this what you're asking for, it's irrealistic. Either is from patients or from assistants pushing, right? The rope, as you were saying, with situations that are not right. Then you will not be able to neither to disconnect and neither to have that great life. So I think that it's very important. The first thing, of course, you have to set boundaries. That's a big step, and the boundaries will allow you to one day just work the 4 days in chair, and the last appointment to be at 4:30. But then you need to be very assertive. You need to be very self-aware. You need to be very, very aware of the red flags. You need to be very assertive on your behavior and your clinical behavior, so that you don't leave your day in a total mess.
Yeah.
So that you can, when you close the door in the practice, you feel at peace. You feel that you've done your best, that you acted according to your values, that you practice the dentistry that you believe in, and that way you can go home and have peace of mind. Otherwise, it doesn't matter how much time you spend at home, or it doesn't matter how much time you have to serve.
Yeah, because your head will not be clean.
Your head will be elsewhere.
Yeah.
Your head will be elsewhere. You're going to bed and you will fall asleep thinking of what's expecting you, or what you just been through during the day, and you will wake up thinking of that. And I just had a colleague during this week saying that he wakes up every morning with this feeling that I don't want to do this.
I understand.
I don't
That's
want
horrible.
to. Yeah, and
That's
how can you go
live
through
like that.
your life every morning and picking up the phone, and sometimes even calling, saying, "Look, I cannot go today." It is every morning he has this feeling, and this is not because he is overwhelmed with work and he's going through work from 9 o'clock in the morning until 9 o'clock in the evening and on weekends. This is not the reason. So I think that it's going back to the basics. It's you can have a great life being a dedicated dentist. You need to set your boundaries straight. You need to have a clear vision of what you want. You need to start making small changes that will lead to a big change. And you need to be very self-aware. You need to also have time to listen to yourself, to be with yourself, to disconnect from the noise from outside. Otherwise, you just do. Your actions will match just the noise from outside, but your actions have to match your inside, what you really want. and you have to be able to be very assertive, and to be able to notice those red flags, and to act according to those red flags. But of course, this needs experience, and this needs also the ability to say no to patients. To say no to patients, and to be able to differentiate those patients to whom you say no to. I mean, I know a colleague that has like a list of, of patients that he doesn't. For example, patients that come and all they talk about is everything that other dentists. So talking badly about other dentists' works, right? So yes, okay, for this ones, I know I have this speech, prepared.
Yes.
So, and experience gives you that.
I have a few that I have said no. I have quite a few that whenever I feel they look at me as a shop or a hairdresser, or they don't understand that they cannot do whatever they want, I dismiss them, and I turn the page very easily with them. It's fine. I don't sleep bad because of that. It worries me much more the well-being. One of the things that worries me the most, of course, the future always worries, but the things that keep me more, that take the sleep out of me, are usually when the staff is not aligned or is not happy. That's usually the things that, because with patients, I think that with experience, you really have to understand, say, no, I'm sorry, I cannot see. I don't think we are a good match. It's fine. You can go elsewhere, and sometimes you can even. Sometimes if they ask the money back, we had an orthodontic case that but so I want the money back from the study that you did, and we, of course, yes, of course, we have your money back as long as you don't come here again. And we are that's something that we do easily.
Let me just go back to one thing that you said, because we're already very long on time. But you said, of course, the future always worries. And this is something that I propose to the dentists that I work with when they do the mindfulness course with me. I always, and you're right, the future always worries. And I always say, okay, are you enjoying the journey? So that should worry you if you're not enjoying the journey. So let's focus on that, and that's what I propose with my 8 weeks courses. My proposal to you is to make you enjoy the journey, because yes, the future will always worry you.
That's a wonderful end to. That's a wonderful way to end this episode.
But let's focus on enjoying the journey, and I think that's a very good thing for dentists to practice on their days, to enjoy their days, and yeah, to have a great life. To have a great life, and to being a great dentist. It's something that are very complementary. You cannot, because I think and you agree with me, we are not proposing that one thing it's completely disconnected from the other. You cannot.
It's not possible.
You said it. Yeah, it's impossible. You said it in the beginning. I cannot disconnect my life from my practice. We cannot. I cannot also. So it's not about disconnecting. It's not about having a great life and on the other part being a dedicated dentist. It's to join them together. It's to have a great life and being a great dentist. and I'm sure that maybe some of the colleagues that listen to the podcast, maybe they were expecting for us to talk about do this after you stop your day, you for having a great life, do this, do that. But no, I think that for if you are a dentist, if you want to have a great life, your dentistry practice should be at peace. So you should work on that. You should work on having a dentistry that you believe in, a dentistry that you can practice feeling that you are giving your best.
Best, yeah.
Yeah, so that when you close the door at the clinic, you are at peace, and then you can go to your family, you can go to your surf, you can go to do the things that you enjoy. But every morning you also wake up feeling happy that you are going to your practice.
Yeah, that's a wonderful way to end this episode. You have to focus on the present, focus on the day, and not much on the next year, on the future.
Okay, thank you everyone for listening, and again remembering that we are going to talk about all of this and to teach all of this, how you can have all of this in our conscience leadership course for dentists in 3, 4, and 5 of March in Portugal, in Sagres. If you want to know more information, just go to softbites.online. You will find all the information there, or just send us an email or a message. And again, thank you for listening.
Thank you, Manuela. Thanks, everybody. See you next time.
Bye, André, and thank you. Bye.
Thank you.